Fundamentally, this is about human health and about trying to reduce human misery. And I think that trauma, adversity, and resilience work, whilst I don't pretend to be an expert in that field, is about trying to reduce trauma and adversity in people's lives, and then working with those people that have suffered to minimize the impact of that trauma. And climate change is very similar, because it's about trying to reduce, or my work in climate change is about trying to reduce the impact that we have on our environment, but then also reducing the impact that the changes that are coming are going to have upon us in society, and particularly in my range of work within health and social care. And I think the other thing that's really important to say is that when you have these multiple crises that are happening all over the world at the moment, and I suspect we're going to come on to that in a few minutes, but you have these multiple crises and you have these multiple accelerators, inequalities, climate change, trauma and adversity, and those accelerators aren't additive, but they're multipliers. So if you have climate change and trauma, or inequalities and trauma, or all three, then the effect is greater than just adding one on top of the other. It becomes exponentially much, much more difficult to manage that and to reduce the harms that we're causing to our communities. Climate change is here, and it is today. And as an example, I would cite the flooding of the Calder Valley. They've had 2, if not 3 100-year storms in the last 10 years. I think increasingly it is here and now. I think there's also, for me, something about, and we were speaking briefly about this beforehand, about that activation and that hopelessness. I feel that overwhelm with climate change, not infrequently. And I suppose this is talking about the resilience part of the ATR, and it's a personal thing. But for me, that my response to that overwhelm is to do something, is to have some action.